So now let's look beyond generic to see the potential magnitude of savings we're talking about. We ran an opportunity analysis on over 8.7 million prescriptions for CMS FRF drugs over the past year. We put this claim data through our analytics engine and evaluated the estimated cost and potential savings amounts by therapeutic class. The potential savings here are available to health plans as members switch from higher cost to lower cost drugs. The 8.7 million prescriptions added up to about $1.2 billion in overall spending. Digging a little farther, we can see that roughly 2/3 of the savings are made up by the following 10 categories. There's a lot of information here, but I want to just drill down into 2 specific examples that help make up these numbers. First, let's look at diabetes. As we know, diabetes is a big problem in this country. Over 34 million people in the United States suffer from this condition. Insulin prices, meanwhile, continue to go up and have tripled in the past 10 years. Looking more closely at the category, we have one example, Novolog, of which 550,000 units were prescribed in our case study at $30 per unit. A comparable brand is Admelog, which comes in at an average of $13 per unit. If our case study health plan is able to get all their members to switch from Novolog to Admelog, they would see a savings of over $9.3 million in retail costs a year. Here, we can see the potential power of how a simple $17 per unit savings can add up quickly when matched with a commonly prescribed drug. Now let's look at rheumatoid arthritis. Rheumatoid arthritis is a costly condition requiring consistent aggressive treatment for many years to control symptoms, manage pain, and stop disease progression. Rheumatoid arthritis is estimated to cost $19 billion a year in the United States, with many patients paying up to $30,000 annually for their medication costs alone. Those with insurance can still end up paying 30% or more of the total cost of certain medications. If we look at the specific drugs in the rheumatoid arthritis category, we can see the following. Humira was prescribed in our claim study about 21,000 times at an average cost per unit of $2,600. We're comparing Humira to other drugs in the rheumatoid arthritis category, and taking into account efficacy, we find that Cimzia, which, while costing $4,400 per unit, requires half the dosing of Humira. This means that switching all 21,000 units of Humira to Cimzia resulted in a savings of over $8.4 million in our case study. This highlights the importance of having accurate dose-to-dose ratio information, since Cimzia, while costing more per unit than Humira, is still more cost-effective since members would be taking less of it. Finally, we did a breakdown of what type of switches were most common and beneficial in our case study. In looking at the chart below, we can see that switching members from a brand to a generic or from a brand to a lower cost brand gave us the greatest cost savings potential at over $70 million for each category. Going from generic to another generic had over $48 million in potential savings, largely due to the high volume of units prescribed for these lower cost drugs. Finally, it is only a few instances where the direct generic was the lowest cost option, and these accounted for roughly $17 million in potential savings. In summary, we can see how much power there is to make a difference in the financial outcomes of both members and health plans by bringing therapeutic interchange analytics into play. And while individual results will vary based on a health plan's own negotiated pricing and preferred drugs list, the overall process and magnitude of the potential savings should remain consistent.